All right, now let us talk about blood vessels. Blood vessels are going to carry blood. Okay, and this is considered a closed system that begins and ends at the heart. There are three major types: arteries, capillaries, and veins. There are subtypes of this: arterioles and venules, which are basically just smaller arteries and veins. As I mentioned, arteries are always going to carry blood away from the heart, while veins will always carry it back to the heart. And capillaries, I haven't mentioned yet, are going to be what allow for the exchange between the blood and the tissues. Capillaries are where oxygen and nutrients are going to get picked up and leave, and waste products and CO2 are going to get picked up and leave, depending upon where said capillaries are. For instance, the capillaries of the pulmonary system are going to pick up oxygen and get rid of CO2. The capillaries of the intestinal tract are going to get rid of waste products and pick up nutrients. The capillaries of the urinary system are going to get rid of waste products and regulate water hydration levels. And then the capillaries of the vast majority of the rest of the tissues of the body are going to pick up oxygen and nutrients and get rid of waste products and CO2 at the capillary level. We have arteries. Arteries are our big fat blood vessels carrying blood away from the heart, and they are going to divide and get smaller and smaller and smaller. Now, initially, they are going to be elastic, or what we refer to as conducting arteries. These guys are able to withstand a ton of pressure and are going to have a recoilability. That mention of a recoilability is going to be important in physiology because it helps with maintaining blood pressure. Muscular arteries, on the other hand, are going to have a nice, big, thick, smooth muscle band and are going to help regulate blood pressure by being able to expand and contract to meet demand. Eventually, they will become small enough that we start referring to them as arterioles. Arterioles are going to have a smooth muscle band in them, and they are also going to have the ability to change their diameter to control the blood flowing through them. Eventually, these arterioles are going to keep splitting, and they'll become so small that they're going to become capillaries. Now, capillaries are very unique. They are a single layer instead of being the tri-layer that all the rest of the blood vessels are. Capillaries are going to unite together to form venules, which are very, very small veins, which will merge together, getting fatter and fatter and fatter until they become big enough to be called veins, and veins will merge together, getting bigger and bigger and bigger until they become the superior and inferior vena cava, superior and inferior vena cava, which can merge together right before they come back to the right atria. The superior and inferior vena cava merge together right before, and that merging is actually referred to the vena caval sinus. And it happens right before the beginning of the right atria. All right, arteries and veins are going to be tri-layer, as I mentioned. Then these layers are called tunics. So we're going to have a tunica interna, the internal one, tunica media, the middle one, and the tunica externa, the outer one. The opening in these vessels is going to be called the lumen. And this opening, this space, is where the blood is actually going to flow through. Now, this is arteries and veins. Arterioles and venules are also this tri-layer. Capillaries, on the other hand, are not. They are a unilayer. They are composed of a single endothelial membrane with a very sparse basal laminal connective membrane. This endothelial membrane and this very sparse connective tissue membrane is going to be why we have the exchange here. We'll get into that. All right, here we have an artistic rendering of what these look like. Over here is an artery, over here is a vein, and over here is that capillary. So we can see the artery has a smaller lumen, it has a smaller internal radius. It has a nice, thick, smooth layer band, and no valves to be seen. Veins, on the other hand, have a very thin, smooth muscle membrane or layer. They don't have a lot of it, and they have valves. Valves are going to be important with our veins because valves are typically working with low pressure systems and against gravity. So we talked about valves with the heart, how they help prevent backflow and keep blood where it's supposed to be. That same is going to apply here. These valves are going to help prevent blood from pooling back down the system with gravity. And then down here we have our capillary, nice, thin, single layer. All right, now that internal layer, that tunica interna, or sometimes referred to as tunica intima, depending on your textbook. Welcome to, by the way, terminology for healthcare. We are constantly changing up the terms that we use. So for instance, when we get into the female reproductive system, you will hear me say interchangeably fallopian tubes and uterine tubes. They're the same structure. It's just back in the day, we refer to them as fallopian tubes. But starting, let's say about, what year is it, 2024? How have I been teaching? About 10, 15 years ago, they started referring to the fallopian tubes as the uterine tubes. Some textbooks just use uterine, some still use fallopian tube, and some jump back and forth between them. So you do need to be aware of the common nomenclature for whatever structure you're handling. All right, so tunica interna. It is an endothelial layer that is going to line that lumen. It forms a slick surface that is going to minimize friction and prevent bleeding of blood into the smooth muscle layer. So again, just like the endothelial layer of the heart, it keeps the blood separate. The tunica media is going to be a smooth muscle and elastic fiber layer, so it is a mixed layer, and this layer is going to be regulated by the sympathetic nervous system. Why is that important? We will talk about that with the nervous system, but it is important. So it's the sympathetic nervous system. And this is going to control the vasoconstriction and vasodilation of these vessels. Vasoconstriction refers to the narrowing of these blood vessels, and vasodilation refers to the increasing of that diameter. The bulbous layer is going to typically, especially in the arteries and arterioles, be this middle layer. And that is because it is going to be responsible for maintaining blood pressure and continuous blood circulation. Then the external layer, tunica externa or tunica adventitia as it is sometimes referred to, that is going to be infiltrated with nerve fibers, lymphatic vessels, collagen fibers, as well as connective tissue. And it's going to protect, reinforce, and anchor these blood vessels to their surrounding structures so they don't shift and move. All right, so our elastic or conducting arteries, these are thick-walled arteries that are typically found near the heart and are the major branchings, first major branchings of the aorta. There's a very, very large lumen. This large lumen or opening is going to allow for a low resistance for the conduction of blood. Low resistance means greater flow. Elastin fiber is actually going to be found in all three layers, not just the middle layer. And this is going to be so that it can withstand and smooth out any large blood pressure fluctuations. This is important because every time the ventricles contract, you're going to have a sudden large push of blood into this major artery, and that large push is going to come with a large pressure increase. So these arteries need to be able to withstand that large pressure increase, but then maintain the pressure that we actually want, even when the pressure drops, because there is a point at which no blood is entering the aorta from the ventricles. The valve is closed. And so we need to maintain that pressure through the system, and this elastic recoil is going to allow us to do that. But again, we're going to get into that in a lot more detail in physiology. So muscular or distributing arteries and arterioles, these are going to have a nice big fat thick tunica media with a ton of smooth muscle, not a lot of elastic muscle. They're going to be very, very active in vasoconstriction and dilation, but mostly constriction. These are going to be at the ends of the conducting arteries and help deliver the blood to the various organs and tissues. The arterioles themselves, as I mentioned, are very, very small arteries and are going to lead to capillary beds. These ones, again, are going to have a nice thick middle layer of smooth muscle, not a lot of elastic tissue, and they're going to both dilate and constrict. They're going to do it all. Our capillaries are the smallest, as I mentioned, and have just that thin tunica internal layer, 1 cell thick. It is only big enough, that lumen is only big enough to allow a single red blood cell to pass through it at a time. There are going to be what are referred to as pericytes on the outer surface of this endothelial layer, and these pericytes are going to be scattered to stabilize it so it doesn't fall apart. Now, they are beds. This is a microcirculatory system is what we refer to it as, because they're so small, and they are literally beds. They are entire networks of these capillaries that are interwoven together, and they're going to have a couple of different aspects to them. There will be vascular shunts, also sometimes referred to as a meta-arteriole, and basically what it does is if blood is not needed in this particular capillary bed at this time, maybe because we have a bleed going on, and so we're cutting off blood flow, trying to restrict blood loss, then these vascular shunts are going to direct blood not to these capillaries, but directly into the postcapillary venule. So it's a workaround. There's damage, or it's not needed, there's too much blood, there's something going on, we don't need blood in this capillary bed. Capillary beds can be anywhere between 10 to 100, and they will typically branch off that meta-arteriole and return at the distal end of the bed. That's why they look like this in this image. I told you it was coming back a lot. They look like this mesh. Here's that bed. Here's that meta-arteriole, major thoroughfare. The capillaries come off of it, and there are sphincters, or think of them as doors that will open and close, allowing blood into these beds as needed. Otherwise, it's going to pass right on through. All right, there's that precapillary sphincter. It's a cup of smooth muscle that's going to surround each true capillary and regulate blood flow into the capillary. This is going to be regulated by our vasomotor nerves, sympathetic nervous system, and local chemical conditions. So if there is something that has triggered a inflammatory response or a clot response, we can cut off blood flow to the area, and it will happen automatically based on chemicals released in the clot. All right, venules. Venules are going to come off of the capillary bed as these capillaries reunite. They're going to allow fluids and white blood cells to pass from the bloodstream into the tissue spaces. And they are going to bring blood back, merge together back to the veins. So postcapillary venules are very, very small and are very simple. They look very similar to a capillary, to be perfectly honest. Large venules are going to have 1 or 2 layers, and that second layer will typically be smooth muscle with a very little bit of connective tissue on the outside. These venules are going to merge together, getting bigger and bigger and bigger until they're big enough to be called veins. Veins are going to be that tri-layer again. Thin tunica media though, not a lot of smooth muscle, but a thick tunica externa with a ton of collagen fibers and elastic networks. This is because smooth muscles veins are typically referred to as blood reservoirs, meaning their walls can expand with very little change in blood pressure for a large volume of blood. So they can expand out because there's a lot of blood coming in, and the blood pressure is not going to change that much. At any given time, approximately 65% of your blood supply is located in the veins, not in the heart, not in the arteries, not in the capillaries. In the veins. Veins are going to have a much lower blood pressure than your arteries and thinner walls. As I mentioned, they do return blood to the heart. To aid in this, they have large diameter lumens, so large openings in the middle with very little resistance, so we have easy flow. And we're going to have valves that resemble our semilunar valves to help prevent backflow. There are going to be what we call venous sinuses scattered throughout, and these are specialized flattened veins with very thin walls that are going to have the ability to contain a lot of blood. We have a coronary sinus in the heart, we have dural sinuses in the brain, and they can hold a ton of blood. Here we have them, a comparison side by side. Again, repeat of this image. And then last but not least, we need to talk about vascular anastomoses. Vascular anastomoses are the merging of blood vessels. And quite typically, we do see the merging of blood vessels in veins and not arteries because that is their nature. Arterial anastomoses are, however, when they develop, provide alternate pathways, otherwise referred to as collateral channels, for blood to reach a given body region. These are an adaptive mechanism. They are designed to help make sure that blood gets to point B when the passage from point A is blocked. So we get a branch that allows it to do that. Thoroughfare channels are examples of arteriovenous anastomoses, so the ones in the capillary beds. This concept right here, creation of an alternate pathway, is important because this is actually something we see with cancers. Cancers, masses, one of their defining features is that they will typically, and this is in the more aggressive cancerous masses, they will emit chemicals, give off chemicals that trick the body into creating a new arterial line to the cancerous mass. So normally the body would try and block it off, cut it off from the nutrients and oxygens, try and kill it by starvation basically, but the release of these chemicals trick the body into sending it a direct supply of food and fuel. That is one of the hallmarks of some of the more aggressive cancers. Not all, but some of the more aggressive ones.